At this time, I yield to another doctor, gentleman from Indiana, Dr. Bucshon, for 2 minutes.
The gentleman from Indiana is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of repealing the Independent Payment Advisory Board, or the so-called IPAB, and I urge President Obama and our colleagues in the U.S. Senate to join us, the House Republicans, in saving access to quality care for America's seniors. I've been a practicing physician for over 15 years, and I don't think I've seen anything potentially more detrimental to seniors' health care than the Independent Payment Advisory Board created under the Affordable Care Act. As has been already said, a group of 15 unelected Washington, D.C. bureaucrats appointed by the President making decisions on the funding of Medicare with little oversight from your elected officials. This is not a partisan issue. Whether it's this president, the next president, or a president 20 years from now, no one should have the power to create a board with this much control over health care. Doctors provide critical care to our nation's seniors, but they also run a business. They have to receive proper reimbursement to keep their doors open, or they will lose their ability to provide care for America's seniors. The Affordable Care Act has already cut over $500 billion from the Medicare program, and then the President doubled down by proposing over $300 billion more in his budget. Medicare cannot sustain further cuts if we're to keep access for America's seniors. Without any chance of judicial or congressional oversight, IPAB will become one of the most powerful agencies within our government. I ask the American people what part of the government operates in this way. When the people in Washington, D.C. make decisions you don't agree with, you can vote them out of office. But when IPAB makes a decision, the American people most likely will have no recourse. If the President and the U.S. Senate really are concerned about saving Medicare, which they claim to be, I urge them to get serious and work with us, because according to CBO, Medicare may be insolvent as soon as 2016. We need to reform Medicare in order to strengthen and preserve it for future generations, and true reform is not continuing to cut funding of the program. Again, I urge the President and the Senate to join us in eliminating IPAB. With that, Mr. Speaker, I yield back.